In fact, this is an exclusive word while speaking to Mirror Now here to the National COVID Task Force member NK Arora. This is regarding specifically the COVID vaccine plan for children on what India expects in the coming few weeks here. Now, NK Arora says that vaccination for children is going to be done in a phased manner. The priority is first to have co-morbid children take the vaccination first. They're likely to be jabbed in the next 4 to 6 weeks itself. So it's that tight a deadline that we're looking at right now. He's further said that the currently 4 to 6 vaccines for children, they are there, but they're still in the pipeline. So not certain when entirely all of this would be implemented. But take a listen in to these details.
Bharat Biotech's Covaxine has been recommended for approval from Subject Expert Committee for administration in children. To talk on that and on vaccines on children, we have Dr. NK Arora. Sir, what is the future of vaccination for children in India, given the fact that we have now 2 vaccines? One is yet to get the approval, the other one is approved. When are we expecting the vaccine rollout for children in India?
Children are our most valuable asset, and we will immunize the children also. And we will immunize them in a similar campaign mode as we have immunized the adults. However, there are 44 crore children in this country, and that's a sizable population. And we expect that in the first quarter of 2022, we should start immunizing the healthy children. However, within children, there is a proportion who have comorbidities, not exactly same as adults, but there are additional comorbidities also in children. Many of these comorbidities make child susceptible to get serious disease or death 3 to 5 times higher as compared to healthy children. But still it is much less than any adult. Now, as vaccines approved for children come in the country, we will start in a phased manner, just like we have done it for adults. In adults also, you remember, we started with health providers, with servicemen and policemen, and then municipal people, and then people with comorbidities and those above the age of 60 years. In a similar manner, phased manner, children will also start getting vaccines in a phased manner. And the first priority is, we are in the process of making a comorbidity list, which is based on both international as well as national data, and who have a higher risk of getting severe disease from COVID. Because otherwise we know that most of the children get asymptomatic disease or mild disease. It is extremely rare to have severe disease or death in children because of COVID. So, but we are in the process of identifying. Once this list is ready, we'll make it public. We have a pipeline, a healthy pipeline of vaccines for children. There are going to be at least 4 vaccines. ZyCoV-D, all of us know, for 12 to 17 years. Then there is another vaccine which have been approved by a subject expert committee, but still there are several steps, and that is Covaxine. And it's the same Covaxine which is given to the adults. Then we have 2 protein-based vaccines for COVID. One is from Serum Institute, Covax, and then there is another one, Carbovax from Biological E. These are both protein-based, and their trials are going on. In next 6 to 8 weeks, those results would also be available most likely. So as you can see, the country, while we have kind of maintained a supply line for adult immunization, now we are preparing ourselves for pediatric immunization. Very soon, mRNA vaccine is also coming, and based on international data, that is also something it's very encouraging that it can be probably used in children. So we are preparing the whole immunization program in a way that children can be immunized. So we expect that if Covaxine and ZyCoV-D, as the discussions are going on, somewhere in next 4 to 6 weeks, I think at least children with comorbidities, we can initiate some initial vaccination in them, these children.
So by the month of November, at least we can expect
By the end of November or somewhere there in next 6 weeks, I think we should be able to do something for the children.
So do we know the efficacy of co-vaccine in children? Because it is for adults, we know the efficacy. What is there for children? And very soon, by how much of, if you can tell us the timeline, how soon can we see co-vaccine also getting included in the vaccination program?
So this co-vaccine, the one which is used is exactly the same dosage and the same vaccine for children also. We have not looked at the data, we are not aware, but the expectation is that the vaccine efficacy will be very similar to what is seen in adults. But subsequently, the data will be reviewed, and accordingly we will see how it works and in different age groups and all those kind of things. Basically, we have to look at the data completely.